to help that person that's like, I do not want to talk to anybody in here. What can you do?
You know everyone.
I don't know where he is. You can go with me. You know the lineup is a story.
No, I just saw when people I figured when he came to the test.
One of the root causes of this frustration, I think, is that there isn't actually a clear clinical diagnosis of long COVID, not in adults and not in children. So for a parent to go to a GP and get a diagnosis, the GP is without the tools to do so. Also, the wide range of symptoms that are common, appear to be common in long COVID, mean that it's actually quite difficult to know which specialist to be referred to in the first instance. So there are examples of extreme tiredness, of gastrointestinal pains, of joint pains, and many, many other manifestations of long COVID. Many of those individuals who are experiencing these long-term symptoms have no record or were not able to access a test at the point at which they were infected. So, it would be somewhat inaccurate to define the prevalence of long COVID without that diagnosis and without the evidence that these individuals have been infected in the first place. I think treating symptoms as you would whatever their source. So there'll be a tendency to assign the cause of symptoms to COVID, but regardless of whether the symptoms are caused by COVID or not, I think treating joint pain or headaches or tummy aches or temperature in the way that you would treat them if they had any other cause, I think would be my recommendation for the time being.
If children are presenting with concerning symptoms, there's a really clear pathway to make sure that they have the right investigations, which might include a chest x-ray or a heart scan or bloods and things like that. But thankfully that isn't something we've seen described in young people. If they're not happy, they can go and see a different GP, or they can just ask for a second opinion. But actually, I think that now that we've explained and established these pathways, that GPs will be aware that this is a path they can take.